Okay. So today we are talking about the face and parotid region. And recall that your parotid gland is the largest gland for making saliva for your mouth. So first off, Dr. Austin wants to introduce you to the clinical correlation of Bell's palsy. So Bell's palsy is actually a paralysis of the facial nerve. Recall that in a previous lecture, I talked about how we have muscles of facial expression and how those are innervated by facial nerve. Well, when you have Bell's palsy, part of facial nerve is paralyzed. So when you end up seeing is that on the affected side, so this is the normal non-affected side. On the affected side, you'll see this drooping of the lip. You can see a bit of the drooping of the eye. And one way to try and tell if a person has this is you ask them if they previously were able to whistle, ask them to whistle now, and they won't be able to do that because like this affected half of their face, like it's paralyzed. So they don't get the proper muscle movement of like to be able to whistle. So that's one way that you can test to see if a person has Bell's palsy. And you can get it for a myriad of different reasons. Some people get Bell's palsy like after vaccination. You can get Bell's palsy as a result of Lyme disease. It's just like a bunch of different reasons why you can end up with Bell's palsy. Okay, so another clinical correlation that Dr. Austin likes to talk about is thrombophlebitis of facial vein. So facial vein runs along in a similar pathway as facial artery in the face. The biggest thing that she likes to talk about is the pathway that an infection can travel back towards your brain. So facial vein is actually connected to this area called the cavernous sinus. And I will show you a picture of where the cavernous sinus is. And actually, no, I think she has a picture in there. That's going to show you the pathway to get back to the cavernous sinus. So the reason why this even happens is that the veins that are in your head, they don't have valves. So it's possible for blood to flow in either direction. Therefore, since the blood can go in either direction, the blood can go backwards towards the cavernous sinus, and the cavernous sinus is like this pathway for the infection to get into your brain. There's different veins on your face that are going to allow this pathway. She lists them here, and there's a picture later on that's going to show you these veins, but I'm just going to say their names now. And then when we look at the picture, we can refer back to their names. So your superior ophthalmic vein, your pterygoid plexus in the infratemporal fossa, which is like an area in the face. And then your inferior ophthalmic and your deep facial veins are all pathways that infection can travel to get back to this cavernous sinus and therefore back into the brain. And she puts this triangle here because in questions they talk about this, how if a person has like a pimple or something like that, they shouldn't pop it, because if you do like in this area, it's easier for it like that infection to spread backwards. So that's why they call this like another danger zone of the face. Just like you had like a danger zone with the fascia that can travel like down, this is another danger zone where infection can travel. Okay, so in this picture, you can see, if you look right here, this kid's chin looks super big and swollen. Well, that's because this kid has mumps. So for mumps, you can end up with inflammation of your parotid gland and get really big like this. So this is like inflammation of your parotid gland. It can be pretty painful as far as I know. Like the kid is not happy, look happy. Okay, so skip over learning objectives. Okay, so for clinical correlations, the muscles of the upper and lower eyelid have different nerve supplies. Which eyelid would be affected most in a facial nerve palsy? I don't know the answer to that. The buccinator has two nerves entering its external surface. They are the buccal branch of facial and the buccal nerve, V3. Only one of these is motor. Damage to which nerve causes paralysis of the buccinator? Which brachial arch mesoderm gives rise to the muscles of facial expression. Okay, so I know she does not give you the answer to these in these PowerPoints. However, for this one, what you do need to know though, so facial nerve versus V3. When you see, okay, bringing it back. So facial nerve is a cranial nerve and it's cranial nerve 7. When you see V3, V3 stands for the third branch of cranial nerve 5, which is trigeminal nerve. There's a lot of information with trigeminal nerve, so I'm just gonna leave that alone for now. What you do need to know though, so to answer this question, so facial nerve is giving motor supply to the buccinator versus buccal nerve is for like sensation, so surface like sensation in that area. Facial nerve is the nerve that supplies the muscles of facial expression, and buccinator is a muscle of facial expression. But it just can get confusing because they both have buccal or buccal as the name of a branch off of them. But you just have to realize that for facial, it's for motor, but for trigeminal in this area, it's for sensory. Trigeminal does give motor innervation, but to a different set of muscles. Trigeminal gives motor innervation to the muscles of mastication via branches off of V3 again. So it can get confusing in that way. But to answer this question, it's going to be the buccal branch of facial is for motor versus the buccal branch of V3 is for sensory. And then brachial arch mesoderm gives rise to the muscles of facial expression. I believe that's 2, arch number 2, because 1 is for muscles of mastication, and I believe it's arch 2 does muscles of facial expression. So this is an embryo question, like this B section here. And when it comes to the brachial arches, that's a whole different set of information to memorize. Because she only listed in this one question, I'm wondering if she wants you to know those arches or if she just wants you to know it, like know this one fact about them, how the second arch gives you muscles of facial expression versus the first arch gives you muscles of mastication. Because yeah, there's a whole bunch more stuff that you can go into with the arches. Why is pain in the parotid gland more intense prior to meal times and somewhat relieved after eating? Okay, so when it comes to salivation, that's part of your parasympathetics, which is your autonomic nervous system. You have no control over that. And for your parasympathetics, it's for rest and digest, feed and breed. So when you see food, your parotid gland starts to produce saliva. It's just one of those, once again, you cannot control this. Versus once you've like stopped eating, your parotid gland no longer needs to produce saliva. You've already eaten and the food has been like chewed and swallowed. So your parotid gland makes saliva in anticipation of you eating versus once you're done eating, doesn't need to make as much saliva anymore because you're done eating. Okay. So these are all your muscles of facial expression. I don't know how many or how much of these she wants you to know. Full disclosure, we didn't have to learn all of these. We only learned some of them. And technically your masseter is not a muscle of facial expression. Your masseter is a muscle of mastication. So I will say that some of these, they are descriptive of where they are. Not all of them though, which kind of sucks. So I guess this is where I would have to defer to Dr. Austin as to how much she wants you to know about this, and if she wants you to know all of these specifically. The big ones that I remembered that we had to learn about was the frontalis, because technically it's occipitofrontalis. There's a muscle in the back by the occipital bone and this muscle here by the frontal bone, your frontalis, and then they're both connected by this aponeurosis between the two. So the muscle is known as the occipitofrontalis. but they're only pointing out the frontalis in this particular picture. We had to know about Obicularis Oculi, so you can see this muscle that's going around your eye, and here's the superior lateral one versus just the lateral portion of it. We definitely had to learn about Obicularis oris, muscle going around your mouth. We'll talk more about buccinator as we go further along, just because of its relationship to the parotid duct. And then, yeah, I learned masseter as a muscle of mastication. And then we've already talked about platysma. Thankfully, mentalis, it's named literally for the area that's in mental, so point of the chin. So your mentalis muscle. As muscles of facial expression, these muscles are innervated by facial nerve, and later on in this PowerPoint, we'll see those branches of facial nerve. And there are two helpful mnemonics to help you try and memorize those branches. So looking at the side here, again, we can see some muscles of facial expression, but we can also see some muscles of mastication. So masseter is a super important muscle of mastication, as is your temporalis muscle. So these two are muscles of mastication. And when I was talking about Occipitofrontalis, so here's frontalis, here's that long aponeurosis, and then here's occipitalis. So occipitofrontalis is this whole thing right here. And then again, here's your Obicularis Oculi around your eye. Here's your Obicularis oris around your mouth. And then here's your buccinator. When it comes to your zygomaticus, so I don't know if she's gone into the bones of your skull, but your zygomatic bone is your cheekbone, and it's right around this area. Hence, those muscles, zygomaticus, are like the muscles over your cheekbone. Okay. So since she gave you this blank page, I'm thinking she might want you guys to know all of the muscles, because this is one of those blank pictures that you would use to practice on. Okay, so unfortunately, this is sort of one of those memorize it moments, but you can use this to quiz yourself. And like I said before, quite a few of the muscles are telling you the area that they're in. So like your zygomaticus, your mentalis, we already learned about our sternocleidomastoid and intertrapezius, your frontalis, Obicularis oculi, so you can remember oculi having to do with your eyes, versus oris, you can think of like oral cavity, the mouth. And those are just the ones I can think of off the top of my head. So this is just something that you would want to print out and then practice on your own to just quiz yourself to try and be able to name all of these different muscles. Okay, so branches of facial nerve. First thing I want to note here, you can see how facial nerve is intimately related with the parotid gland. It actually pierces through the parotid gland. However, it does not innervate the parotid gland. I'm going to say that again. Facial nerve pierces through the parotid gland, but it does not innervate the parotid gland. Instead, facial nerve is coming out here to innervate these muscles of facial expression. So I'm just going to point out the branches, and then I'm going to tell you about the mnemonic that I used when I was learning this. And then I'll also tell you a mnemonic from a different person that I tutored that helped them. So first branch you can see here is our temporal branch. It's literally going to like the temporal area of the skull. Next is our zygomatic branch, which is going over that cheekbone area. Then you've got your buccal branches, which are going over the actual cheeks themselves. You have your marginal mandibular branch, or here it's just listed as your mandibular branches. So it's going over the mandible. And then here coming down towards the neck is your cervical branch. Now, I'm going to point out this last branch, even though it's not labeled here. This is your posterior auricular, I think, or occipital. Posterior occipital, I want to say. Hold on, because it is labeled later on. Where are you? Posterior auricular. Okay. So this is your posterior auricular branch. Now, the mnemonics that I learned did not involve, like they didn't include this branch, but learned it just in case, because that's one of those, like they could still pop that on you for the test. So the mnemonic that I learned was 10 zebras bit my cheek. 10 zebras bit my cheek, standing for temporal, zygomatic, buccal, mandibular, and cervical. The other mnemonic that I heard that some people said helped them was to Zanzibar by motor car. To Zanzibar by motor car, or 10 zebras bit my cheek. Whichever one works best for your brain, use it, keep it. There is this lovely picture and more of a person putting their hand on their face to show all the different branches of facial nerve. And I think she has it in here. There we go. To show you the different branches of facial nerve. And here is listed as marginal mandibular. But yeah, so this is just another thing you have to memorize. So in this particular picture, they're showing you the parotid gland. Okay, I don't know if she meant to put this picture specifically here at this point. But what I will say though, is that you see this branch here of V3, auriculotemporal. So auriculotemporal does a lot of innervation in this area in front of the ear. It does innervation of your temporal mandibular joint, your TMJ, and it also does innervation of your parotid gland. So it just sort of does a lot of innervation in this area here. It also does some sensory innervation in your ear, but I don't think you need to know that yet. Okay, so again, our branches of facial nerve, and you can see in this picture the different branches going out to innervate the different muscles of facial expression, including occipitalis in the back here. So again, our branches, here's our temporal branch, our zygomatic branches, our buccal branches, our mandibular branches, our cervical branch, and our posterior auricular. And just once again to reiterate, facial nerve pierces and travels through the parotid gland, but it does not innervate the parotid gland. Okay, so talking about the parotid duct, and also this is just another diagram showing you the different branches of facial nerve and has them labeled for you, along with muscles of facial expression. So the parotid duct is the pathway that saliva takes from the parotid gland to get into the oral cavity. You can see here in this picture that it pierces through the buccinator muscle. However, where's that lovely picture of it? There we go. So it pierces through the buccinator. However, it actually goes past and around your masseter. So it doesn't pierce through the masseter, but it passes like on the anterior border of the masseter and then pierces through your buccinator. So that's the two muscles that your parotid duct are intimately related with. So it passes over the masseter and then comes at that anterior border and then goes through the buccinator muscle. And where it opens, you're going to want to know this because I know you get quizzed on this. It opens opposite the second maxillary molar. So parotid duct passes over the masseter and then in front of its anterior border, pierces through the buccinator muscle, and then opens up opposite the second maxillary molar. And again, in this picture, you can see the different branches of facial nerve as they're coming out of your parotid gland. You can see how big your parotid gland is, going from like your cheekbone all the way down to your mandible and in front of your ear. Okay. Yeah, and these are all just like good diagrams. Pick whichever one works best for your brain and study it and know it. Okay. So again, so here they've taken a slice out of the face, like out of the cheek area. And you can see here how this is your mastoid process. And then your facial nerve actually comes out near a foramen that's near your mastoid process. And it pierces through your parotid gland, which they're showing in this like flesh colored area here. And then it's also showing you the ramus of the mandible, as well as your masseter muscle and the medial pterygoid muscle. Those are two muscles of mastication. Those are innervated by V3, so branch of trigeminal nerve. And again, they're just showing you the different branches of facial nerve as it's piercing through your parotid gland to go out and innervate those muscles of facial expression. So you get a better like 3D idea of what's happening. Go ahead. Did someone have a question? Nope, okay. Okay, so here we have another 3D picture trying to get you to understand what's happening. So you can see your facial nerve exiting out and then going through your parotid gland and then the different branches coming out. So you can also see here your parotid duct going around your masseter, piercing through the buccinator, and then opening opposite that second maxillary molar. And then they're also showing you like different muscles in the area too. Okay. So, all right, so this is when I have to take a moment and ask, what did she talk about when it came to in terms of the branches of V3? Because I'm wondering how deep she wants to go with these. Anybody? What did Dr. Austin talk to you about with this particular slide from class today?
I don't remember.
Okay. Crap. All right. So, all right, let me think, what's the best way to do this? Cranial nerves. No. All right, let me pull up some stuff about trigeminal, because trigeminal is a lot, guys. I'm wondering how deep she wants you guys to know about trigeminal, because it does a lot. Okay, actually, we're not gonna go that deep. We're gonna go surface and hopefully this will be fine. When it comes to trigeminal nerve, they're showing you the different branches of V3. So trigeminal, literally the name tells you that it has 3 parts to it, V1, V2, V3. We're concerned about V3 because trigeminal is one of your cranial nerves that does sensory and motor, so it does both of them. And it does both because its motor innervation is for your muscles of mastication. All the rest of the branches of trigeminal nerve are sensory. So you can see they actually are showing you in this picture. It's not very good because it's black and white, but they're showing you in this picture your muscles of mastication. So you have your masseter muscle, your medial pterygoid. Where's lateral pterygoid? Lateral pterygoid is another muscle of mastication, and then your temporalis muscle. So those are your 4 muscles of mastication, and they're innervated by V3. Now, all the rest of the branches of V3, because there are quite a few, all of those are sensory. So yeah, you can see, although having said that, is this B3 or is this cranial nerve 7? So this is cranial nerve 7 coming out. So I guess this is just trying to show cranial nerve 7 some more. Yeah, this gets confusing. Okay. Because auricular temporal nerve is from cranial nerve 3 versus all the rest of these are branches off of 7. So I guess it's just trying to show you that, again, facial nerve coming out and piercing through the parotid, but auriculotemporal nerve, which is off of V3, is also in this area. Okay, I'm gonna leave that alone otherwise. All right, so arteries in this area. We already talked about your 8 branches from the external carotid. I'll review those again since we're here. So here's your common carotid, which branches into your internal carotid and your external carotid. And your internal carotid is going to go up to give blood supply to the brain along with your vertebral artery, which is back here. So your external carotid, you have your superior thyroid, your ascending pharyngeal, your lingual and your facial, your posterior auricular and occipital, and then your maxillary and your superficial temporal. Well, we make note of those arteries here on the scalp because you can see how superficial temporal, posterior auricular, and your occipital artery are giving some of the blood supply to the scalp. These other 2 arteries, though, your supratrochlear artery and your supraorbital artery, they are actually branches off of internal carotid. So internal carotid went up into the skull, into the brain, and fed into the blood supply for the brain. However, it also gave off the ophthalmic artery. And the ophthalmic artery is going to go towards the eye, and it's going to go through the orbit, and it's going to give off branches, including your supraorbital artery and your supratrochlear artery. So both of these came off of internal carotid artery via the ophthalmic branch. Other thing I want to point out in this slide, she puts tortuous here because she's describing your facial artery. So when they say tortuous, they mean like twisted. So you can see how facial artery is coming off of your external carotid artery and it looks twisted and has this like windy path across your face. Well, that's what she means by tortuous. And then this is just another picture that's showing you your different branches of your external carotid. However, it's also showing you your vertebral artery coming up through the spine and then going into the skull. There's your internal carotid artery, and they have it cut off here. These are the 2 blood supply to the brain. So when internal carotid goes in, it sends off its ophthalmic artery, and then, ophthalmic artery is going to branch into, I believe, a supratrochlear and supraorbital. Yeah, supratrochlear and supraorbital arteries. You can see that a little bit better here as they come out and then go up. Okay, and that was a repeat slide there. Okay, so remember how I mentioned before that danger zone of the face, trying to get, so how venous blood supply can get back into the brain via the cavernous sinus? Well, here's your cavernous sinus. This is supposed to be showing that it's like back inside the brain. And those different veins that Dr. Austin highlighted in those opening slides, you can see them here in this picture. So you can see how superior and inferior ophthalmic arteries can lead to the cavernous sinus. You can see here how your deep facial vein, it can lead into your pterygoid plexus, which leads into your cavernous sinus. You can see here how your angular vein on the side of your nose can lead back to your superior ophthalmic vein, which then leads to your cavernous sinus. So pretty much all pathways can lead to your cavernous sinus, but especially this area that's around your nose. So remember those important veins that she talked about. So your superior and your inferior ophthalmic. Remember the angular vein for the sides of your nose. remember your deep facial vein leading into the pterygoid venous plexus, which also leads into the cavernous sinus. To get a better idea of blood getting back into the cavernous sinus, was it on this one? Was it cranial nerves? Yeah, it was cranial nerves. Okay. I just have to find that slide again. There we go. So this is a picture, or this is like a slice of what your cavernous sinus. So this slice is like the top of your head's up here, the bottom of your head's up here. And all of this blue is venous blood. You can see here how there's no valves. And technically it's not like a vein, it's a sinus, which just means it's an opening. So this is how like blood can travel back into your brain, because like there's nothing to stop it. And there's nothing to stop the infection if it gets into like that venous blood supply, because like there's no valves, it just is there. Okay. Like they have it like lighter here because they're trying to show you this is inside of the skull. So here's that sigmoid sinus leading down to your internal jugular vein. So here is inside of the skull. And like, again, there's no valves here. These are all just like openings. And they're made by the meeting of your it's your dural venous sinuses. And I don't want to get too much of it because it gets too deep into head and neck. But yeah, so the biggest thing is there's no valves. So infection can spread back into the brain via these branches into the cavernous sinus. Okay. Oh yeah, and then here is another like depiction of your cavernous sinus. Okay, so again, I don't know how deep she wants to go into this because this is a picture of trigeminal. And like I said, trigeminal literally in the name, tri meaning three, 1, 2, 3 branches, and that's V1, V2, and V3. So I don't know how much she wants to go into this versus the other cranial nerves that are there. Did she talk, so how much did she talk about the cavernous sinus and how much did she talk about cranial nerves in lecture today? Hello? Okay.
Did someone say anything or?
Nobody said anything.
Oh, I think I didn't hear the question. I'm sorry. What was the question again?
So how much did she talk about cranial nerves? Did she only talk about trigeminal and did she want you to know more?
She scanned of a trigeminal, of course, like talking about the buckle, I think. But she did talk about the cranial nerves a lot.
She didn't?
She do talk about the cranial nerves a lot.
Okay. How many slides do we have left? Yeah, all about. Yep. Okay. Yeah, we're gonna go into cranial nerves. Okay. It seems like the ones that she have listed here is mostly about trigeminal. So I'll talk about trigeminal a bunch. And then did she talk about just trigeminal or did she talk about like all of the cranial nerves? Did she talk about just trigeminal or did she talk about all of the cranial nerves?
I honestly don't remember. Like,
okay.
We don't
I think it was
know.
just the
Yeah, like
trigeminal
no one
nerve.
is.
Okay, just trigeminal.
She-
All right.
Yeah, she started talking about the posterior and the anterior part of the brain. I mean the head.
Okay, so like the anterior fossa, middle fossa, and posterior fossa.
I can't really remember, but I just remember the trigeminal nerves.
She also focused a lot on the nerves that catch a ride to the brain on the hypoglossal nerve.
Okay. Okay. Well, I'll talk about trigeminal and then, oh gosh. Okay, so I have a PowerPoint that can help you with cranial nerves, but there are a lot of them, and you really should get clarification from her as to how much she wants you to know about cranial nerves, because you can have a test just on cranial nerves. So I'm going to talk about trigeminal, and with what time I have left, I can talk about the other ones, but it's a lot of information is the thing. So yeah, we'll talk about trigeminal. All right, so in this picture, here, backing up. So like I said before, trigeminal, three, it has 3 branches. It's this huge nerve here. This is considered the trigeminal ganglion, and then you have the branch of V1, V2, and V3. V1 is your ophthalmic nerve. It does a lot of stuff with the eye. V2 is your maxillary nerve, and V3 is your mandibular nerve. And V3 actually has a motor branch, and that's how you get motor innervation to the muscles of mastication, is via V3's motor branch. So trigeminal is mostly a sensory nerve. They have these areas labeled here 1, 2, and 3 specifically because V1 does sensation to this part of the face, V2 does sensation to this part of the face, and V3 does sensation to this part of the face. Now, be careful. Notice how your greater auricular nerve is giving you sensation on this lower part of the ear versus V3 is giving you sensation by your temple, or I guess between like your temple and coming close to your ear. So try and remember the different areas, like the delineation of where you have sensation, because she can get pretty particular about like what areas are innervated by which nerves. So like knowing that below the eye is V2, but above the eye is V1. Knowing that the top lip is V2, but the bottom lip is V3. So just getting good at noting these maps of V1 versus V2 versus V3 sensation, because she can get nitpicky with like the areas. So not only the trigeminal, but the spinal nerve sensory map, because I know that's come up in questions too. So greater occipital coming off of C2, third occipital coming off of C3, lesser occipital coming off of C2 and C3, and then greater auricular coming off of C2 and C3. You're going to want to know the area that it innervates, and for these, you're going to want to know the roots, because I know that I have recalled that coming up in questions previous for other folks. You can actually see here the different branches off of trigeminal. So the branch of the branch. So V1's branches, supraorbital, supratrochlear, lacrimal, infratrochlear, and external nasal. V2's branches, zygomatic temporal, zygomatic facial, and infraorbital. And then V3's branches, auriculotemporal, buccal, and mental. So be careful. Do the best you can to try and memorize this. I know it's a lot of information in one picture, but she can get pretty specific with it. So this is another picture that's giving you like looking down at the skull, at the scalp, your arterial blood supply versus the nerve supply for sensation. And you can see how some of these are going to have shared names. So supratrochlear nerve, supratrochlear artery, supraorbital nerve, supraorbital artery. And then it kind of falls away. So how you have greater and third occipital nerve versus just occipital artery. Oh, excuse me, greater, lesser, and third occipital nerve versus just occipital artery. And then, yeah, here's our zygomatico-temporal nerve, auricular temporal nerve. And note V1 branches versus V2 versus V3. And then versus coming directly off of the spinal cord. And just a reminder, supratrochlear artery and supraorbital artery are branches off of ophthalmic artery, which is a branch off of your internal carotid artery, versus superficial temporal artery, posterior auricular artery, and occipital artery are branches off of your external carotid. So technically, these arteries represent an anastomosis between your internal and external carotid arteries. Okay, again, here is trigeminal, the ganglion, and then there's V1, V2, and V3. This particular picture is showing you the different branches off of V3. So something I want to note, because it's come up in questions before, you can see here, this is auricular temporal nerve, and see how it like sort of makes a loop here. So this area in the middle is where the middle meningeal artery passes through. That's another fact that I know that Dr. Austin likes, is that middle meningeal artery passes through this loop that is made by the auricular temporal nerve. And a middle meningeal artery actually is going up, and like back into the skull to do like blood supply up there, but it's on like the outside, it's blood supply to the meninges. And there's a whole other clinical correlation with that artery that I won't get into. So just know that auricular temporal nerve, when it forms this loop, it's middle meningeal artery that passes through the loop, because I recall that being a question that like has come up before. Okay, so looking at these different branches of V3, you're going to see branches for your muscles of mastication. So your masseteric nerve going to innervate your masseter, your deep temporal nerves going to innervate your temporalis muscle, and then the nerve to your lateral pterygoid and the nerve to your medial pterygoid. Here are your innervations for your muscles of mastication. So 4 muscles, 4 nerves. And then you can see all the different sensory nerves that are branching off here. And again, most of these are going to have names that will help you know either where they are or where they're giving sensation. So mental nerve is going out to your chin and it actually passes through a mental foramen. So it's coming out on more superficially. You can see how you have incisive branches. These are going like to do innervation on the jaw of the teeth. Let's see. So chorda tympani and lingual nerve. This is when we come into parasympathetics, and this is a whole other thing. Okay, so your tongue has innervation, both general and special sensory, because recall that our tongue is what we use to have the sensation of taste. So lingual nerve gives general sensation to the tongue. So this is something hot or cold? Where in space is my tongue? Like, am I pressing against something? That's what lingual nerve is doing. So general sensation. Chorda tympani does special sensation. So that's taste. And the other thing that I need to note is that this sensation of the tongue is just the anterior 2/3 of the tongue. The posterior 1/3 of the tongue has a different innervation for general sensory and special sensory. But for the anterior 2/3 of the tongue, chorda tympani is special sensation, so taste. And chorda tympani is a branch off of facial nerve. Well, that's it's a misnomer to say it's a branch off a facial nerve. So it's parasympathetics are a little bit complicated, guys, in that they originate in the brainstem. They follow along cranial nerves, and there's a whole like pathway that they take, and there's synapsing at ganglion. So to simplify this, I'm just going to say chordotympany, special sensation to the anterior 2/3 of the tongue, lingual, general sensation to the anterior 2/3 of the tongue, and leave it alone after that. Other thing that's important here, you can see this is your submandibular ganglion. So your submandibular ganglion plays a part in innervation to your submandibular gland, specifically for salivation. So not only is chordotympany running along here to do special sensation to the anterior 2/3 of the tongue, it's also running along here for parasympathetic innervation for salivation to the submandibular gland. It can get pretty complicated. I know this is a lot I'm throwing at you, and I apologize, but it's a lot of information in one picture. Yeah, and actually, while I'm here, let me parasympathetics. There we go. So, nope, that's for the eye. Not in the eye right now. So this is like a picture of the parasympathetic pathway that I was talking about, and how, yeah, parasympathetics are complicated, and I'm hoping that she doesn't like make you guys learn that too quickly. But yeah, I will include the parasympathetic slides with my email in case you want to study this, in case she brings it up again. And if she does, please let me know, because we should talk about parasympathetics for at least a good like 20 to 30 minutes if she does bring up parasympathetics again. Okay. So this is another picture, but well, this is the picture that we had before, but in color, so it's easier to see stuff. So you can see, like, here is that submandibular ganglion I was talking about for innervation of the submandibular gland. Here is chordotympany joining in with lingual to go do innervation for the tongue, and then chordotympany also helping with parasympathetic innervation of the submandibular gland. And then here is that auriculotemporal nerve splitting so that middle meningeal artery can pass through on its way up to give blood supply to the meninges. Like, yeah, this is a picture that has a lot of information, and I don't know all the things that she wants you to know off of it. Here's, like, you can see sensation for like your buccal nerve. Here is, let's see. So your deep temporal nerves for innervation of your temporalis muscle. What else do we see here? Yeah, it's just, there's a lot in one picture. Okay, here again is our mental nerve coming out of that mental foramen for sensation at the chin. And then and then here's your inferior alveolar nerve. So it's been cut, but it's going to travel down and then give sensory innervation to the lower teeth. When you see alveolar, think teeth, because there's inferior alveolar for innervation of the lower teeth, and then superior alveolar, which I believe comes off of V2 for sensation to the upper teeth. Okay, so this particular picture is for parasympathetic innervation to the parotid gland. So let me show you in a different slide, because it'll just be more helpful because it has more words. Oh no, she has it already. Great. So when it comes to parasympathetic innervation for the parotid gland, this is another one of those complicated pathways that really wish we had more time to talk about. So actually, let's go to a different one because mine has words on it. Oh, wrong one. Not that one. There we go. All right, so once again, you guys are going to get these slides to study from. But when it comes to salivation of your parotid gland, it's actually done via, okay, backing up. For parasympathetic pathways, there's different parts of them that you're going to have to learn to best understand this because they can test you on all of this. So a parasympathetic pathway starts at a nucleus or cell body in the spinal cord, or excuse me, in the brainstem. There are preganglionic fibers that your parasympathetics are going to run on. They're going to synapse at a ganglion, then run along posterior ganglionic fibers, which are going to be a branch of trigeminal. And then there's going to be an end organ that they go to innervate that cause an action. The particular one that we're going to talk about is parasympathetic innervation to the parotid gland. I'm just going to click ahead till we get there. Nope, too far. All right. So when it comes to parasympathetic innervation for the parotid gland to cause salivation, those nerve fibers start at the inferior salivatory nucleus, which is in the medulla of the brainstem. Their preganglionic fibers are on the lesser petrosal nerve. These preganglionic fibers synapse at the otic ganglion and then run along V3 auriculotemporal to get to the parotid gland. So here is your trigeminal ganglion, here is V3, here is your otic ganglion, and then here is your auriculotemporal nerve right here. Remember, it splits for that middle meningeal artery. Your lesser petrosal nerve is right here, yeah. Lesser petrosal synapse. Okay. So again, here's your otic ganglion, and then the fibers run to your parotid gland for salivation. So you start at the medulla, run along, synapse, and then go to the parotid gland. And they even have a little break in there just to remind you that this is auriculotemporal nerve. Parasympathetics is all about memorizing like the pathway for each of these. Because for each of these, it's a pathway. It starts in one place, it runs along these fibers, it synapses, it runs along different fibers, it gets to its location, it does a thing. Hopefully she's only going to make you learn about parotid gland, because technically there's like 4 different pathways that she could possibly make y'all learn. Because there's a pathway for the eyes, for like making you constrict your irises. There's a pathway for salivation of your submandibular gland. There's a pathway to get you to cry, so like your tears being released. And there's the pathway for salivation of your parotid gland. She will not make you learn like the 5th pathway, because that has to do with vagus nerve and your gut organs, and that's for more of when you're like in abdomen. So that's way far off. But yeah, I'm hoping she only makes you learn this pathway, or at worst, this pathway plus the pathway for your submandibular gland for salivation, because that one is actually even shorter for memorization. But like I said, I'm going to send this PowerPoint to your class reps so you guys can like reference it if you need to when she brings up parasympathetics. Okay. And I believe, yes, that was the last thing that she talked about here. And yeah, this is just another one that's talking about like presympathetic fibers versus your synapsing at the ganglion versus your postsynaptic parasympathetic fibers, the organ, and then what is its action. Okay. So with that, I'm actually going to stop sharing and I'm going to stop the recording.